device in these situations to change that breathing tube very safely and effectively without the delicacy of maintaining the fiber optic scope in exactly the right position. My specialty, originally, I'm fellowship trained in neurosurgical anesthesia, and this involves putting people to sleep who are having brain surgery primarily, or surgery on their spinal column and spine. This invention that I created stemmed from some research that we were doing in the patient simulation laboratory a number of years ago. A fiber optic scope could be inserted into the existing endotracheal tube, preloaded with a new one, and we could slice out the old endotracheal tube and then slide in the new one. All this under direct visualization of the split in the trachea where it goes to the right and the left side. The device offers some other advantages that we would hope to promote. We have been getting by, of course, with our current methods of changing out endotracheal tubes, but this device, as an improvement over existing devices, also allows us to stabilize the tube in and against the mouth, so that when we remove the original tube, there's not movement of the stylet. If there's movement of the stylet, then it can either come out of the trachea and that thereby losing the airway, or it could go in too far, and there have been reports of it puncturing the lung, specifically through the windpipe. Now, we're primarily talking about using this device in patients who otherwise have a difficult airway. It would be easy to change a breathing tube in somebody with normal anatomy who we could simply look in the mouth with an existing type of device, a blade. We could see the original tube entering the windpipe. We could remove it and place a second new tube under direct vision. This is a device that would interest companies that have experience in changing endotracheal tubes currently. The companies that develop these devices are aware that there's no direct visualization through their device in order to maintain the proper position of that device in the windpipe. And so that was the advantage of changing the endotracheal tube in the manner that we had researched. This device is the next step in improving safety and reassuring the doctor that they are doing the technique safely and effectively.